over immediately to Dr. Edward Pearson. Dr. Pearson?
Thanks, Patty. Hello, everyone. Thanks again for joining us. This is Dr. Pearson, and I appreciate everyone on the call tonight. Had a very intensive webinar last week. Really wanted to get through the diagnostic model and how we just simply think differently over here in New Medicine, how it all ties together, how the key concepts of the strong science behind New Medicine and the principles of detoxification, regaining proper nutrition and restoring any hormonal and nutritional deficiencies and restoring balance is so important and applies really to any illness out there. We've discussed in other webinars in depth hormones and hormonal imbalance, why we all have to detoxify and how to best do that, and how much functional medicine and functional nutrition come into play and how much science and biochemistry is in this. So tonight we're going to wrap up what I consider to be the initial information for the general public that's interested in New Medicine, what it is. We call it New Medicine 101 in a way, and it's topic tonight's case studies. So we're going to take a look at quite a few examples of people that have treated with us over the years, of the several thousand that have, and some typical examples of what happens with different patients, how quickly they get well, how many kinds of symptoms and health problems and illnesses and quote traditional diagnoses get better. Everything from young people to elderly to from very sick people to really relatively healthy people. There's quite a few slides as there were last week, but this is a seminar that's geared a bit more to the scientific body. So we're going to skim through a lot of the slides that show a lot of lab work. They could be paused on if you want to study how much biochemistry we test and review. When we give lectures to health practitioners of all backgrounds, naturopaths to MDs to chiropractors to osteopaths, we really dig into that science and explain exactly what's going on inside the body, because that's the key. But tonight we'll just gloss over that stuff because it's a little bit excessive, I think, for most people, even myself from time to time. So we're going to get into this tonight and really just take a look at all of the great things that we see happen in our patients. I'm going to start with a wonderful patient we had, a 43-year-old who had and some of these may seem common as well. We've used a couple of these before in previous webinars, but we're going to include them tonight, but a little bit more briefly. This is Tim, who's just a great guy from the Midwest, and this is an example of a person with a fairly significant illness, 15-year history of pretty severe multiple sclerosis. As a lot of patients are when they come to us, Tim had been there and done that with all of the big clinics. Cleveland, Mayo, spending thousands of dollars, tried all the medications. You know, there really is no cure for MS. They simply come in and turn off your immune system with all of these horrible toxic drugs. We simply say we're going to come in and restore health to the body. These illnesses have been around for decades. We're not going to promise that we're going to heal completely, but we do typically see at least a 75% improvement, and on average I'd say about a 90% improvement in all illnesses. This is a patient with a chronic severe illness. We're going to recommend what we refer to as the elite plan. That's where we're going to do 6 full months. We're going to do initial labs, follow-up labs, and yet another set of labs towards the end of the care plan. We're going to do a full 6-week detoxification, a stabilization period, and yet another detoxification of 3 weeks to really try to get everything we can out of the body and, of course, do all of the hormonal work that we do. Tim was ready. He was referred to us by one of our great associate docs, chiropractor out there in the Kansas City area. He hadn't seen much improvement in 5 to 7 years. He wasn't taking any meds, which was nice because he knew they weren't helping. It's a great picture of Tim, and he's come to be known as the fish man for that real pretty looking bass, I guess that is. Obviously not feeling great and got a cane and not as healthy as he should be. Here's some of the lab work. I'm really just going to skim through. You can these will be recorded. You get on the website and pause these if you want to look at all that we check, but typically it's a lot of lab work we get. All it means is a few more tubes of blood. That's good to give a little bit of blood. We're looking at biochemistry again from our other webinars that other doctors just don't look at. They're not trained to look at this stuff because there's no drug company teaching them how. So hormone levels, immune system markers, very in-depth sugar markers, growth hormone levels, vitamin markers, of course, blood counts, inflammatory markers, regular chemistries. We look at all of that and well beyond that. In a nutshell, his results. Tremendous improvement in energy, lost 35, I think, or more pounds when we were done, received that incredible education that's such a key part of our training and our treatment is not just the correction, the treatment, the scientific data that's being done, but it's the education of how to continue living this life and not have these problems come back. And the most important thing is that he did experience that 75% improvement in symptoms. So he still has MS. We didn't cure the MS, but we did reverse the degeneration in his body enough to the point where he was functioning at such a much higher level than he was before. Much more functional, active with his kids, active in life. So much, much healthier. And that's really what we're looking for. Let's get people as healthy as they can, get them off medications if they're on it, and get them feeling better and looking tremendously better. So that's always a nice side benefit too, is you're going to lose weight, you're going to feel good, you're going to have a much improved vitality. And these were the follow-up labs. Again, you can compare and contrast these with the labs before and see improvements across the board. I believe these were follow-up at 3 months, and then we even did another set. And you just simply restore balance to the biochemistry. That's really the bottom line goal, is not just a weight loss program, not just a detoxification, not just let's do hormonal balancing like so many are doing out there now with anti-aging and excessive hormones. It's all about biochemical balance. It's all about thorough lab testing, accurate lab testing, efficient lab testing, not going overboard with it. A lot of doctors now in functional medicine just do way too much testing, and there's just so much that you can do, but you don't really need to. Restoring balance, that's what it does, and you get these improvements. So still got the cane, but it's a little thinner, doesn't need it quite as much as he did before, and just feels a heck of a lot better. Had a lot of really neat improvements, and wrote us a nice testimonial about that. Case number 2. This was a real fun patient, Texas area, great guy, very, very successful person. And he had an initial surgery mishap that really disabled his ability to just stay active in life. And that initial surgical problem that so disabled him, a surgical side effect, a mishap, really was the starting point of his downward spiral. Just that inability to be active really set him off on the wrong path, and he just was kind of spiraling downward with health problems and weight gain and energy problems and just a lack of zest for life, trying, needing medications, being prescribed medications, spending lots of money, and just not feeling good. In fact, this really, as poor health does, which is why we've got to get back to health, is really the main focus of life, is it just takes the really desire out of life sometimes. This is part of what leads to inactivity and depression and relationship issues, and you lose that drive and that excitement. And that happened in this gentleman, and he was a really great guy. Well, we just did our thing. This was a master plan. Didn't need the 6 months, but just 3 months. Although he's a true believer now, and does come back for a detox about once a year. And his results were incredible. And this is what we typically want to see. I would say we were well above 90% health improvement in him. He immediately lost the weight he needed to lose. He felt great, had his drive back, as he described it, his mojo, which is awesome. Love treating men. Men are hormonal as well, and they're just not getting treated correctly. This is another great quote. Mayo Clinic couldn't do blank. I won't say that. I'll try to keep the cuss words out, but now look at me after 6 weeks. That's what he told his chiropractor who had referred him to us. So it's really that easy. He needed some work. He needed a detox. He needed a lot of education. He needed focus. He needed a lot of hormonal balancing. His body was pretty worn out. But once we did that, and we did it all at once, it's just life and health come right back. And he actually is off now chasing his dreams again. He's a real go-getter, and health is at the bottom line of that. So that is exciting, and that's what we typically see. Really, those are expected results, whereas most things out there in healthcare might say this, these results aren't typical, aren't common. We're going to say this is typical. We expect, because we see it so often, almost all health problems resolve and have people stay there because of the education that's part of it. Going into another patient, another 56-year-old. This was a female and a wonderful, wonderful person. This is an interesting, different kind of patient because this person wasn't very unhealthy, was very naturally minded and health conscious, but just knew she was not as healthy as she should be, had some energy problems, had some sugar cravings, wanted more out of life, wanted more out of health. So this is what we do with our basic plan. Only 6 total weeks of care and only a 3-week detox, 1 round of labs. That's all we need because we know they're not going to be that far out of whack, but we've got to get the information. And she was a naturalist. She needed to see the science that we do. She needed to see those labs. As many people do, we know science is there to really prove a lot of things these days. It's a useful tool. It's not the end all, but certainly we can show a lot of what's going on biochemically. And this is Karen before. Doesn't look horrendously unhealthy. But when you see her pictures afterwards, as we'll show you, you'll see what happens. Very quickly, 3 weeks, restored energy. The sugar cravings were gone. There's always a nice weight loss. Again, it's always a side effect. Even when you're relatively thin, there's always some unwanted fat that people lose that they really like to do. It's a great way to lose the trouble fat because it really goes right to it. Great education and just a wonderful referring patient, of course, because people, when they get this healthy, they love what's happening. And this is Karen afterwards. And this is really just, you go from looking good to looking phenomenal. And this is phenomenal. Not so much a little bit of weight loss, but a lot of changes in the face. I always see a lot of spiritual and energy and aura improvements. You just see people's whole attitude lift because you're restoring what's missing in their life. You're really removing toxins. Things are clearing. You're removing things that are getting in the way. Lifting the fog is what so many people say. It's what I first felt years ago when I was looking for a detoxification, and I tried it myself. You're clear, your clarity, you're bright, you have energy and ideas. Partly getting rid of those toxins and partly restoring what's missing. These were her labs. I did them side by side here. Could show maybe a few real quickly. Huge cholesterol drop. You wouldn't expect high cholesterol in her, and even though it's a little high, it's well balanced. That's more important. So her initial cholesterol wasn't a problem, but overall it drops 50 points and her ratio improves. Inflammatory markers like C-reactive protein improve. Sugars drop. Homocysteine, an inflammatory marker, improves. Vitamin D levels we bring up. Sugar markers improve. I mean, this really goes on and on. This is what we do. This is what I do day in and day out. And I love the patient results. I love the education. I love the experience. But really, at heart, I'm a scientist. That's what we learn. That's what we study. There's a reason that I've taken biochemistry 3 times and had a chemistry minor in college and microbiology. You know, this is really what healthcare these days is about. We need to get this biochemical balance back. That's most of what's going on these days. Then we can deal with any other problems out there. We can deal with mind-body problems. We can deal with structural and electrical problems with chiropractic and acupuncture. There's more to be done, but biochemistry is what's so far gone these days, and this is what we do. We just restore it, and it's why we absolutely make at least 1 round of labs mandatory in our patients. We have to see what's going on. We typically see blood counts get better. We are looking for estrogen levels to drop, on and on. Again, lots of labs here. And that's what we do. There's the before and after. Those are great pictures, and that's 3 weeks. Really exciting. Thank you, Karen. She's just a wonderful person. Next case here. This is where we get into a real different type of patient with new medicine. That's a pediatric patient. We treat patients as young as they come. These are not adult problems anymore. Kids are getting chronic illness. We described that last week, how juvenile chronic illnesses are really degenerative diseases in the young person's developing body. So immune system problems, neurological problems, and hormonal problems are the big ones. We don't necessarily detoxify them or treat them with prescriptive bioidentical hormones. We start with labs, we start with nutritionals, And depending on the severity of the problem and how much the family is considering dangerous and addictive medications, then we sometimes step up and say, now it's time, we've got to do some hormonal restoration. That's why they're so deficient. And as they get into their teen years, they may become applicable for a detoxification at a certain point in time. But typically we're gentler and gentler with children. This was an interesting case where a 12-year-old who all of a sudden getting into those pubertal years just had severe problems. Her very first period was severe and difficult. Her attitude changed. The entire family thought that she was really having issues mentally and personality-wise. Her mother, another wonderful patient, knew that was not the way to go, knew medicating her, using birth control, what have you, was not the way to go. We know that really what's going on here is this child is becoming more hormonal and is already estrogen dominant, and her body's not keeping up with the progesterone needs. So all we did here was get saliva-based hormonal testing, find that low progesterone level, and replace it only when she needs it. So instead of being on birth control around the clock, which is synthetic and carcinogenic and just horrendous, this girl just needs a little bit of bioidentical progesterone just a week or two out of the month, and it completely resolved her problems. In fact, I think the mother told me that the rest of her family was fairly traditional in their medical desires, didn't want to do anything natural or alternative, so she didn't tell them. And just in that first month of treatment with us, which was so easy to do this, we know exactly what's wrong, the whole family said, wow, she's better. What'd you do? You must have given her medication or something, because it's all better. Low-dose progesterone during the pre-menstrual times, everything resolved, and everybody's happy. There's those things I was commenting on. So that's all a question of a child who the hormonal imbalances are there now at birth, they're developing, and as you get into puberty, the body will be either able to take off and transform that person into an adult, or the glands are already shut down from the toxins and the poor nutrition and deficiencies already, and it's simply not going to, the body's not going to rev up and go, and that's when problems are going to arise. There are going to be hormonal problems that are obvious in girls. There's going to be the weight problems. There's going to be the mental associations of hormonal imbalance, a lot of anxiety, depression, irritability, difficulty getting along. That's all hormones, and it's so easy to fix when you know what to do. We don't need drugs. We just need to get balance. Here's a great case. This is a friend of the foundation and another really very healthy-looking young woman, but a bit of a history of just that trouble with her cycles, mood and energy problems, so typically prescribed the birth control and even antidepressants that are given to almost everybody with these complaints now. So again, a real quick need here because she looks relatively healthy, and the basic 3-week detox, 3-week follow-up, full labs, getting her off the medications. Always a little bit of a task with psychiatric meds. They're just so strong, addictive, and dangerous. We should not be on them unless we are severely, severely depressed and have already had all of the new medicine balancing we do, because most of these problems are going to go away. Antidepressants are just horrendously toxic. But everything basically went away, and her energy was back. She felt great. Periods were normal. Didn't need any meds. I mean, that's just what happens. You just restore balance, and not to mention, she then looks like this, which I don't think anybody would have a problem with. She lost 20 pounds. She feels great. She's very athletic and able to do all the physical training stuff that she likes. So that's how easy it is in someone who's relatively healthy and just has a few problems. Now we'll go into a more severe patient. This is a 47-year-old female who had sudden onset menopausal symptoms at 47, just lots of crazy stuff going on, nausea, vertigo. She said she felt like a zombie, the hot flashes, really felt horrible. She had a full workup. She went to her physicians. They did all they do, did heart checks, and I think they might have even done a cardiac catheterization in her, not a procedure without risk. Very profitable, though, I might add. She just did everything that they said, and it really did nothing to improve her symptoms. So she's getting ready to medicate, was smart enough to go try some over-the-counter progesterone cream, which is on the right track, but we'll prove the point here. Progesterone cream shouldn't be done in creams. It's not accurately dosed, and hormones should not be taken over the counter. You'll see why whenever I see a patient who's taking progesterone cream. For the most part, it's completely misdosed, usually much in excess. And I told her things are never to be looked back upon. The comprehensive workup you had from the traditional docs is great. They cleared your heart. We know nothing life-threatening like a heart attack is wrong. That's not what's going on. But she was biochemically quite a mess, very estrogen resistant, very toxic, you would say. Had sent this menopausal sheet just loaded and loaded with yeses and symptoms. She just didn't feel good. She's just a great person. Finally made it to us. So over the course of the last few years, she's had the elite plan, but initially it was the master plan, the 6 weeks of detox, appropriate hormonal balance, because she was really trying to do it on her own inappropriately, which is happening so much these days. She lost weight. The severe symptoms went away, the zombie, the vertigo, the nausea. She was fairly imbalanced, though, so it took a bit more, another test or two. She was really toxic in a lot of hormones that both environmental but also the ones she'd been self-prescribing really too high. When you overdo hormones, as a lot of anti-aging docs, most anti-aging docs do, it'll stress your body out as well, and it'll convert to other hormones, so you don't want to do that. She had a cholesterol drop there initially. C-reactive proteins, inflammatory markers are dropping. Again, not going to harp on these, but restoring vitamin D levels, lowering sugar levels. She had a lot of biochemical imbalances that we were correcting. And again, this is all the labs that we do. She felt about 50% better after the first round, and we did the elite plan eventually, and she got feeling really well. She's got to pay close attention to her lifestyle, but really we keep her there now. And to jump ahead to her saliva test, you'll see here on the left, to look at one thing, her progesterone level is off the charts. Now, we talk about progesterone being low in almost every woman, but women who use over-the-counter creams, typically a little bit's good, a lot's better. They take way too much, and that's not the answer either. It makes you high in everything, stresses your adrenals out. And on the follow-up test, we'd gotten her down from off the charts to 800, and we're bringing her estrogens down. She had some conversion to testosterone as well, DHEA coming up, so we were more than halfway there, and since that time we actually just got another test on her. It looked very, very normal, and she was a unique patient. She needed quite a bit of hormonal balancing, quite a bit of detoxification, but that was the key. She's feeling good. This was a 55-year-old woman with a severe history of fibromyalgia. Now, this is a great topic because fibromyalgia, chronic fatigue, these are illnesses, diagnoses that are so poorly understood. They're just thrown at anybody that doesn't feel good, that hurts, that's tired, that they can't find another diagnostic box for them to fit in, and they really have no idea what's going on. Fibromyalgia is simply inflammation throughout the body, especially in the muscles. Chronic fatigue, you've got a lot of weakness and lethargy with it. They are somewhat immune-related in nature, as all illnesses are, though. So they're treated heavily with medications. There's also a lot of viral ideas that might be at the root cause, but really, when our bodies are healthy, we can handle viruses. That's not the primary cause. It can be another stressor on the body. It's all about biochemical imbalance. And these poor people that are given these illnesses, they too spend thousands of dollars. They're looking to feel better. A lot of doctors think they're crazy. They get antipsychotics. They get addicted to narcotics. They get just tons of crazy treatment. And this is how simple it is. This was our standard basic plan here. Tremendous improvements in cholesterol. Again, we won't go through all of these, but again, the labs are here to show what we're doing through and through. Restoring biochemical balance, both hormonally, nutritionally, cholesterol markers, stress markers, you name it, getting the hormones balanced. There's a tremendous progesterone deficiency here. It's restored. Huge part, adrenals restored. Getting the estrogens balanced, getting her feeling better. The clinical results here were incredible. Her fibromyalgia basically disappeared nearly immediately. So as soon as we started detoxifying her and restoring what was missing, all of these problems, these aches and pains and energy problems that had been there for over a decade, disappeared. We see this commonly. We're not going to say that we're always going to see this, but we do expect it. We see it commonly. The body's able of incredible healing, and it wants to heal. So when you get it on the right path, this is how quickly it can happen. And really, she was amazed. Her husband was amazed, and a thin, strong guy didn't really feel like he needed a whole lot of treatment with us, but said, heck, if you look and feel this good, I'm going to do it too. He did a quick plan with us, and he had actually tremendous hormonal deficiencies, but was just a tough, strong guy. Said, I'm just a little tired, I'm tough, I'm in my 60s, it just is what it is. But he said, well, actually you're really hormonally deficient. Let's do a quick detox and get those hormones restored, appropriate levels, at appropriate conservative levels for you. He felt great. So that's another part of it. We can help both the very sick and those that aren't so sick, or those that don't think they're sick, or just not sick but not healthy, not unhealthy. We're going to just find how balanced they are and get them as healthy as possible. So she said, I should have done this years ago. That's our view. This should be preventative care. This is the testing and diagnosis. This is the evaluation that should be done to everybody, because everybody's got these imbalances. That's why chronic illness is epidemic. It's not rocket science. We're toxic, we're malnourished, and we're hormonally imbalanced. Another great pediatric case here, 15-year-old boy. Again, these kids have such incredible parents that are smart enough to bring them to a truly health-promoting doctor, a healer, hopefully someday all practicing new medicine principles. He's in his pubertal years. His mother sees him having new problems. These parents see their children changing. They see their personalities. They feel like they're losing their kids because they just start to become different people, and they know they don't feel well. So irritability, insomnia, attitude problems, trouble in school, lack of interest. And she said, can you help him? Absolutely. He's hitting those years where he needs those hormones to take off in his body to become a man. They're not doing it. We need to see what's going on before some other kind of treatment gets involved, which is usually off on that downward spiral of medications and no education and no correction of what's truly wrong. In fact, the medications that are given to these kids make the imbalances worse. They're toxic in themselves. So we did full testing on him, found a significant deficiencies. Really, his testosterone levels were that of a 70-year-old, very nutritionally deficient as well. And this is the time where this child, some of these glands cannot be kick-started. They've really been disconnected from the rest of the central nervous system. You just have to give him a very appropriate, inexpensive, organic, dosed, balanced hormone restoration for him, and hope that will rest the body, teach the parents about detoxification. Maybe someday his glands will pick up again, but you can't go through life when you're having that many problems. Did what we did, costs about $50 a month to take what you need, a few little pills that are exactly what that person needs, and the results were that what she said, her son is back. Not to mention that puberty took off. He was growing, developed, felt great, balanced, really just kind of forgot he never felt well, interested in all the things a young boy should be interested in. That's what happens. That's how easy it is. You can imagine what a traditional doctor would probably have done. Antidepressants, maybe Ritalin, maybe Prozac, who knows what. No education, no thorough labs, no nutritional education or work, no vitamin D3 restoration, no adrenal help. The body's just going to continue to spiral downward. So we've got to get this knowledge to even pediatricians. When these problems come into your office, you've got to do the testing. At least do the testing, and then we'll decide how to treat them and teach you how to treat them, because we've got to stop overprescribing for kids kids are getting too sick. You know, we have a lot of alternative practitioners that do not like traditional medicine but love what we're doing. Here's a great example, a 43-year-old who's a healer, believes in all natural care, but doesn't know how to take care of his problems of being overweight, tired, brain fog, looking for the answers out there, knowing enough not to go with those other organizations that we're going to try to correct the aggressive alternative anti-agers. There's just so many groups out there trying to do well, but they just don't know what they're doing, unfortunately. Came to us, master plan was appropriate, 6-week detox, 3-week follow-up, stabilization. It's the master plan, full labs, before and after, hormonal work. He was incredibly deficient. Here we'll focus in just on some lab results that we've summarized. This is incredible cholesterol, and we see this more and more, not just a huge drop of 52 points, more of the drop in the LDL. Again, that's the stress marker that's just going to come down when you de-stress the body in all ways that we do. But look at that HDL improvement. HDL is the good cholesterol, the one they're trying to find a drug to and wound up killing half the people in their study. It's about restoring hormonal and nutritional balance. And that's just, we saw these and said, you know, here's another one, call the FDA, call the AMA, we figured it out. You know, they don't care. They want a drug. They want something that's insanely profitable. They don't want people doing this. It'll cut into their profits too much, but it's so easy when you know what you're doing. 40-pound weight loss, feels great, energy back, brain fog gone, clear as a bell. That's typical. One more fairly ill patient, 35-year-old, just a wonderful person, and health problems throughout her young life, endometriosis, a hysterectomy in her early 30s, and Graves' disease, a thyroid problem, not getting well, treating the symptom after symptom, master plan with us, full care. She's really, I would say, cured. I mean, everything is better, more energy, think clear, feels like she's in her 20s. We helped her with her daughter's problem as well. She knew this was the answer. Incredible. We'll focus on pictures. This is Lisa. Pictures for her. Pretty typical looking American these days, and really not even recognizable. Actually had a hard time figuring out which before picture was hers before I met her, because her results afterwards were phenomenal. And again, this was the master. We're after 6 months, but that fast, that's that. Again, we're not focused on weight loss or vanity per se, but certainly people are going to look and feel wonderful and better because they're healthy. It's just a side effect. But just got a few left here. This is a really interesting case, something I'd never heard of before. Was Cogan's disease, a really interesting autoimmune illness where you lose your eyesight and your. Again, the standard treatment is for traditional doctors to shut down the immune system with very strong synthetic steroids and cancer-treating drugs like methotrexate, just horrible drugs that have horrendous side effects, not getting to anything about the root of the problem. This patient was also had been exposed to narcotic abuse. You know, as a nurse, being in the health professions, it's difficult for nurses and doctors who don't feel well to not get into medication abuse because it's just all over the place. It's so at your disposal, and they're so addictive. You know, narcotic abuse. I was in pain management for years trying to get people off these things with Suboxone and detoxification, and had quite a bit of success. But this medication abuse is such a big problem. Anyways, we did our treatment with her, and this was another one of those amazing stories where her hearing came back within 3 days. And that's because my theory was that so much of it was from not just progesterone deficiency, but she had incredible adrenal deficiency as well. So there's a lot of theory right now that adrenal deficiency, and specifically aldosterone, which is a hormone that regulates your mineral balance, and in the ear, the nerves in the ear work with minerals going in and out of your nerve cells. So there's theory that that's at the cause of a lot of non-injury related hearing loss. Seemed to work well in her. She got it all back. felt great, 20-pound weight loss. So had an interesting follow-up with her, a very young rheumatologist who's an immune system doctor. And we had a discussion, and the doctor said, well, she's got Cogan's. She's going to lose her hearing. She's going to lose her eyesight if she doesn't follow the protocol of the gold standard, all the drugs. And I said, yeah, but is she not better? Well, yes, she's had some improvement. Well, then does she really have Cogan's? We've just restored balance to her body and given it what it needs. Does she really have this illness? And this immune specialist, this traditional doc, could not figure out what I was saying. In her brain, this is how they think, this is how brainwashed they are. This patient has been given a diagnosis, she needs these drugs. End of story. Could not even wrap her head around the idea of healing, the idea of restoration, of biochemical balance, of the fact that maybe a diagnosis is just a name given to a person with some symptoms of the problems that we correct. Really pretty scary. But she did great. That, I believe, that was a misplaced lab from the previous chiropractor. Some more improvements that we saw on him. And just one or two more, I think now. The 63-year-old, again, a health professional, a Pilates instructor, very into health, into activity and exercise, but not able to really be there herself. So trying to eat right, trying to exercise right, in fact, being a teacher for others, which is why we want to get out there and teach all of these people who want to help others with their health how to truly do it. Everybody from the medical doctors to the Pilates instructors to just people that want to be health counselors. We want to teach them how to do it the right way, give them the scientific background and the new medical foundation to back them up and work as a team. But she came to us, master plan, in fact, referred by a chiropractor who had been a patient, saw what he had done, very quickly her results. 35-pound weight loss she'd never been able to lose, tremendous cholesterol improvements. We got on top of her thyroid problem that had never been balanced right. It's very, very easy for us. Leptin's that hunger and weight hormone we talk about, 27-6, why you come out feeling great, not being as hungry, restoring progesterone and vitamin D. Her major symptoms, aside from the weight gain, were insomnia and nighttime achiness. That went away completely, and working with her to get this care to others through the DNA network. And like many others, gets very, very healthy and then wants to just go insanely healthy. And usually a lot of people come back and say, I want to do a little bit more work and just get, to get to where I want to take pictures and show them off to everybody. That's what a lot of people do, because you can get looking so healthy and fit and vibrant when you get healthy. And last but not least, in tribute to our esteemed VP of Marketing and Business Development, Bob Torsey. This is Bob and our also esteemed VP of Marketing, Patty Johnson. Bob was a believer when he came, when we met, and wanted to get healthy himself. Was maybe enjoying life a bit too much here with his Paris picture and this other picture here. And very quickly, this was a basic plan here with an extra week, which is what a lot of people do. They'll do a 3-week detox. They might just want to do an extra week or two. You don't necessarily have to go 3 or 6. It can be some mix of the two. Bob did 4 weeks. This is what he looked like. A little bit of biochemical balancing, good detoxification. Looks like a strapping young man, which is what everybody should look like at all stages in life. There's not anything true to being gaining extra weight as we age or not feeling as well. We should feel vibrant and healthy and fit as long as we are able to stay on this planet. That's how it works. And that wraps it up. That's a good sampling, I think, of the work we do from young children to middle-aged, healthier people, middle-aged, unhealthy people, chronic illness, severe illness. This is primary care, really. This is what needs to be done in everybody, at least the testing. Find out what's going on. Find out the quiet biochemistry inside people, what's really at the root of their mental and physical illnesses. Correct them. The tenets of new medicine, detoxifying, educating about the toxicity of life, restoring nutritional education and an organic life, and restoring hormonal balance with the correct principles, because we know hormones are important. They're out there all over the place, but they're being done incorrectly. So thanks for listening to those. We are getting done a little bit early. It's 8:42. I'll hand it back to Ms. Johnson if she's there. We could perhaps take a few questions or decide to wrap up the night. Thank you all very, very much for listening, and this will probably be it for the year, so have a wonderful holiday season, and be sure to tell everyone we're running some specials. We've got a quick start plan to try to get people really excited about getting healthy before the end of the year. We're excited about this plan to get it to everybody out there that needs it. Thanks again very much.
Thank you, Dr. Pearson. Thank you, everyone, again for joining us this evening. That was a great presentation. As soon as this video is converted, we'll be up on the website. We look forward to you joining us for our next webinar. If you are on our email list, you'll get notified. And if you are not, just send an email to info@newmedicinefoundation.com, and I'm happy to add you to the list. And you can also check the events page of the New Medicine Foundation website, where we list all of our upcoming webinars and other events. So thank you again for joining us. We'll see you next time. Good night.